Welcome to the Health Buzz Podcast with Dr. Cindy Ross, PhD. Many medical doctors refer their patients to Dr. Cindy for natural medicine therapies focused on balancing nutrition, vitamins, lifestyle changes, and other natural health approaches.
Hi, I'm Cindy Ross with the Health Buzz Podcast, and I have with me today Drew Mulvey. Am I saying your last name correct?
Mulvey, yeah, you were correct.
Mulvey, yeah. I'm always like, am I saying it right? So Drew and I actually go back. I feel like we've known each other for a really long time, and then I feel like we still have so much to know about one another, and that's why I'm so excited about today's podcast. Drew and I actually go back, I don't know, I guess like 2020, 2021 when we met, and I was applying for an internship where she had just finished the program, and we just instantly connected on social media and chatted back and forth. And then recently just had a pretty in-depth conversation. We both talked about going dry and eating disorders and our practices. And so we were chatting, well, I guess it was like a week ago, and I was like, Drew, come on, be a guest on my show, and let's talk about eating disorders, because it's something that a lot of my patients know, but I haven't been too public about it, which I'm always pretty public about my life and transparent about it. So I want to just introduce Drew for a second before she chats. So she has an extensive background. She went to the University of Bridgeport with a Master of Science in Human Nutrition, and then received a Bachelor of Arts in Biology. And then she also is certified as a dietitian nutritionist, as well as board certified nutrition specialist, certified elite therapist, precision nutrition level 1 coach, NASM certified personal trainer, certified integrative sports nutritionist, and has her own practice, Redeeming Life Nutrition. So, wow, Drew, tell me a little bit about what you have going on.
So all of those things like put together. Yeah. So with the board certification, I got my master's program. Or I have my master's, and then we have to do something kind of like RDs do. So we had 1,000 clinical hours. We had to take a rigorous test. And what I try to say to people is it's more like a registered dietitian in the alternative route. So it was very functional medicine and integrative medicine heavy. Now, I've been an athlete most of my life, and I realized that a lot of those recommendations in the functional medicine and integrative health world were really not conducive for an athlete. In fact, it harmed me actually doing a program. So then that led me to look even deeper from my struggles. I had several food sensitivities, and that's where I got that MRT test to be a lead therapist to walk you through it. And then I found this program to become a certified integrative sports nutritionist, which basically blends all the fields. You can look at nutrient depletions before they become deficiencies and utilize all of those extra lab tests, but you really get nitty gritty on what nutrition does, functional nutrition, lifestyle interventions, and really bringing out the most abundant part of your life and your athletic potential. So that's why I have like a nice blend of everything.
I love it. You're one of my people. So Drew, I don't know if we've ever talked about this. Did you ever go through the NANP board?
Nope.
Yeah. Okay. So I guess it's very similar to what you went through, because it is the holistic side of dietitian as well. Like, it's just another board certification, but it was a bear. I don't know how your board certification was, but it was probably, I failed the first time. Actually, I was within, like, I think I made, you had to make a 70. I made a 69.8. I was so just distraught. And then the next, I did it a week later, ended up making like an 86, but it was probably one of the hard, I would say even over my doctorate and PhD, it was probably one of the hardest things I've ever been through. Do you feel the same way about yours?
Oh my gosh, yeah. I mean, it was so specific for all the little details that you need. I was happy that I passed with like a 76,
It
and I
was
think
so
they did like a
specific.
75 or something.
Yeah.
It was something in the 70s, or maybe it was a 72, but all I know is it was just within like
I know.
points that I passed. So
That's why I was like, when they told me my score, and they were like, you can take it one more time. And I was like, schedule me now, because I was like, if I'm this close, that's just one question away. And I just did not, because it is so detailed, specific. I didn't want to lose any of that information. Like it was so fresh. I was like, and my poor husband was like, oh my God, I have to go through another week of this stress. So yeah, I know what you went through for sure.
yeah, definitely.
So let's talk about this for a second. So I wrote just a little kind of, I don't think that a lot of people realize the correlation between eating disorders and athletes. And what did you play growing up? What was your sport?
Well, I did a bunch of different sports. Like I was just a natural born athlete. And then finally, at the end of middle school, I kind of had to make a choice. It was either going to be field hockey or diving or tennis. And some of those I did throughout like high school, but I really focused on diving. And that's where my passion was. That's where my love was. And I actually ended up going to college for that too.
I think I watched some documentary on Netflix about some girls that dive. Actually, no, it was just the other day. No, it wasn't a documentary. It was Sunday morning, and they were talking about the cliff divers. And this
Oh,
one girl's from Australia, and it was like her dream to be, of course, it'd be an Olympic sport and her compete. But they
yeah.
dive off these cliffs, like in Italy and Australia, all over. And I think their height is maybe like 70 feet. And she talked about through the years, like how she really battled with eating disorders, because it was like the lighter she was, the better her diving was. And so she
Yep.
really, really battled. So I played pro tennis and modeled, which was a terrible combination, because it was growing up playing tennis. It was carbs, carbs, carbs. You needed the carbs, and they didn't really tell you about nutrition. Just eat the pizza and eat the pasta. And so I was always fighting my weight. And I was anorexic. And then when I couldn't starve myself anymore, I went into bulimia, where I would binge eat. And you and I chatted about this, I think, along the same path. So there's a
Mhm.
huge, huge correlation. And that's why I thought that this was so important. I have a lot of mom patients that have daughters and sons in sports. But I definitely see it a lot more in the female athletes that I think that would benefit from this podcast. So I thought that that's why it would be so important for us to talk about it. So female athletes, they actually face a heightened risk of eating disorders due to a combination of factors: the intense pressure for peak performance, coupled with societal expectations around body image. That's where I was modeling and playing tennis. It was a horrible combination. Um,
Mhm.
it contributes to conditions like anorexia, bulimia, disordered eating patterns. In sports where weight classes or aesthetic ideals play a role, these issues may be more prevalent.
Yep.
So, Drew and I are going to dive deeper into this complex issue today. It's very crucial to consider the psychological, nutritional, and physical aspects involved. Athletes might adopt restrictive eating habits to meet weight standards, negatively impacting their health and performance. Additionally, the constant scrutiny of their bodies can lead to body dysphoria and other mental health challenges. Um, a comprehensive approach to address these concerns involve a collaboration between medical professionals, nutritionists, and mental health experts. Recognizing the signs early, promoting a healthy body image, and fostering a supportive environment within the sports community are very essential components of prevention and intervention. So, Drew, tell me, do you see a lot of the body dysmorphia in your setting, like the patients that you see?
Oh yeah, definitely. I mean, that's one of the things that when they've grown up with that, one of the reasons that it creates this is because maybe their body changes and they start getting more attention. And usually with that, there's something underlying with that. And it's usually a character trait. It could be perfectionism. It could be the need to be loved. It could be low self-esteem. It could be a whole bunch of other factors. But that's what yeah, I definitely do see that where there's a correlation between those two, or especially being an endurance athlete. Oh, well, if I just weigh a little bit less, then I'm going to be better, or I want to look like what those amazing runners look like. Like you look on Instagram and they have like six packs. But unfortunately, that's not always reality, and you have to look at what the health of the person is as compared to what the outside is.
Drew, I think you're a lot younger than I am. I'm so thankful that I did not grow up with social media around, because I can only imagine the added pressure with social media. Like, I mean, even as a 46-year-old female now, sometimes it's hard. I mean, we have our off days and you're scrolling through and you see this perfect body and you're like, oh, how do I get that? And we really aspire to want to be better, and I get that. But I think the approach that I take in my practice, like when I have a lot of people that come to me for nutrition counseling, especially they're bringing their kids to me. A lot of females, 13, 14 years old, seeing type 2 insulin resistance a lot because they're overweight, they're holding weight in the middle, it's affecting their hormones. And I approach it with, hey, it's not a diet, it's a lifestyle change. And I really want
Yeah.
you to get this before you go off to college, to where you have all the choices and you don't have mom and dad restricting you of what you're doing now, but you're adulting and you're able to make all the choices on your own. And I want you to make the right choices, because I
Right.
didn't have that. I mean, like, I literally, no one taught me about nutrition. I had coaches living with me, but they didn't know about nutrition. They just
Yeah,
taught me
I didn't
how to,
either.
they didn't know. And so it was a lot of just, of course it was for endurance on the court and eating for that. And it wasn't feeding my body right. And so I was being counterproductive on the opposite end, starving myself when no one was around, until I couldn't anymore. And my body changed and my hormones changed. And I think that that's what we're seeing a lot. And and those eating disorders, it's like you and I talked about the other day, they never go away.
No. Mm-mm.
Even as 46 years old, there's days I think about it. I mean, I know how to do it correctly now, but it's always going to be there. It's always going to be something that you have to be mindful of and control and make the right eating choices. Every single day we have a choice.
Right.
Do
Yeah, no, I mean,
do
that's
you
so
do you
key
think
because
about it?
oh my gosh, yeah, of course. And I mean, like just what we were talking about, there's always times in our life, and they usually come up when there's extra pressure and extra stress, and there's just a lot of life things coming at us, and you get caught up in that. And you think it's almost like you get lost in that social media and you get lost into those things in this alternate reality that things are going to be better that way. And then you start kind of, okay, well, maybe this is going to work. Well, maybe I'll do this, maybe I'll do that. And there is a good way to approach that, and you need to be in a really good state of mind and be educated on what food is actually doing for your body and for it to be controlled. Because we all know that rapid things or extreme things, it's not going to do us any good. In the long run, it's going to crash our metabolisms, it's going to imbalance our hormones, it's going to just it's just a cascade of things that we don't want to get into. So, but yeah, no, I mean, even just recently, I'm kind of getting out of it now where I had a wake up call like, wow, I think I actually stopped listening to my body. And so now I'm on the mend, like, body, what do you need? What do you need? Carbs? Do you need this? And that's really about like respecting this body and respecting who you are and knowing that self-worth, that it's okay to actually eat. Your body actually needs that
Your
fuel.
body
But
needs
yeah, when those
nutrients.
triggers are there, oh my gosh, yeah, of course. And I mean, even as practitioners, like we all need somebody to lean on. And that would be a really ideal time to have that group of people for that support to lean on.
That's exactly right. No, I agree so much. Um, I see. I had a patient. It's been a minute now, probably back 3 years ago, and she comes to me, and oh my gosh, I could just see myself. Do you see yourself in your patients? And I
Mhm.
saw that. I think she was like 14, 15. And I saw myself in her, and she's stick thin, afraid to eat, crying in my office. Her mom steps out so she could feel like she had the freedom to chat with me. And
Yeah.
she's like 6 feet, where I never had that. I never had that height. I was always the short one. But she had just debilitating eating restrictions on herself. And we talked and we worked together for about 6, 7 months. And I saw her about 6 months ago. She's thriving. And it was the fact that she actually learned the right tools. She learned to listen to what her body needs. And moms, if you're listening out there and you have a daughter that's in athletics, and Drew, I know that you can attest to this, get them in nutrition counseling. Like, even if you don't feel like that they have a problem right now, it's almost like going to your first marriage counseling session before you're married. It's just a good, I feel like it's so imperative, especially for females, because we put that added pressure on ourselves.
Yeah,
But
yeah.
going into college and going into adulthood, it's so important for us to learn how to eat properly now before it becomes a full-blown issue. And that's exactly what you were talking about. Like in our practice, we're looking at labs and everything for imbalances, nutrient, vitamin deficiencies, so we can fix something before it becomes a full-blown issue. And that's the way that you got to look at this. They may not have restrictive eating disorders right now, even body dysmorphia,
Right,
but
right.
it could lead to that down the road, and especially being around other peers going into college. So I just think if it's just like hiring a personal trainer. Learn how to do everything correct now, so it sets you up later in life. And I think that that's what's so important. And I wish I would have had that growing up.
Yeah, oh my gosh, I do too. I mean, I didn't have that when I was going into college. Well, first of all, I was a vegetarian because I just didn't like the thought of eating animals. Well, I was a pescatarian. And I'm type O. My body did not like that, but I didn't have anybody monitoring me.
Same.
I did have somebody helping me out. I had the best diving coach ever my junior year in high school, and he was a vegetarian too. And so he was helping me out with that. But then after that, I didn't have these tools in place, let alone when this did happen, I didn't have that support system. And it's really important that you don't put it on the athlete that it's their fault because there's something underlying. And so that's where there's the counselors, that's where there's the nutritionist making sure, well, this is how much you actually need to eat because this is your daily energy expenditure, and this is how much protein your body needs because you need to be able to recover. And bring them back to what's important. They want to be able to perform well, they want to be able to thrive, and to have those tools going into college, they're going to be able to reach their athletic potential. Not just that, they're going to have a great quality of life.
That's right. Because they're going to have the energy. That's a good point that you just made. I got raped very young. I was 14.
Mm.
So my eating was one thing that I could control. It was like something that I could restrict myself. And I think that going through the years, eating disorders, I definitely think that they stem a lot from pressures, trauma, things like that come, and we don't have the tools. We don't know the correct tools how to deal with them. At that age, you don't have the know with how to navigate life with some type of trauma like that. So my eating disorder growing up was very much attributed to my rape, because it was something that I did have control over. And
Mm.
so I think having a team of people, like if you see an eating disorder, if you see signs of eating disorders, you have to look at the big picture, and you got to think about a team. Have the nutritionist, have the therapist, have the coaches.
Yep.
And just as adults, we have the team, we have the financial advisor, and we have the accountant, and we have the bookkeeper. And it's the same thing. You got to have the team to make sure that your person is thriving, at their best, at their
Oh,
absolute best. So what are some signs? What are some signs that moms could look for? Moms, dads, what could they look for?
yeah. Well, first look at performance. Are they not increasing their times each week? Are they not recovering properly? Are they not sleeping properly? Well, there's also that they might not even know that they're doing this. This could be out of ignorance. And actually, a big thing now is red S, so relative energy deficiency in sport. And so these are some of the signs that they're not improving. They're tired all the time. They're not really thinking clearly. They're not sleeping well. But then it can go into a little bit more detail when they're hyper specific about not doing this or not doing this or logging that or logging this, or starting to isolate from their friends and not going to social events because there's going to be foods that they don't know about. That's a really big red flag. Some other symptoms. I mean, the individual overall, if you're type A, if you're a perfectionist and you have a lot of self-discipline, which a lot of athletes do, they could be doing this unknowingly, thinking
Absolutely.
in my case, I thought so I wanted to lose a little bit of weight for my second half of the season so that I could start competing better and then I would just be more comfortable in my skin because here I was in a bathing suit all day. I was in a bathing suit for my sport. And I was so hyper specific about not having certain things. And that's where it developed into the bulimia that I started throwing those things up because
You were
I
so
thought,
restricted.
oh, I'm disciplined. I can't do this. And I'm a perfectionist and I've got this. And, it wasn't until like 3 months later where the light bulb went on and it's like, that's a problem. But yeah, definitely. If any of those signs that you're seeing or even avoidance of foods when you're eating dinner or just skipping of meals, making sure that maybe you're sending the things with them at school and they're coming back with the lunch bag full.
That's right.
It's like little things like that.
Or them
So,
making excuses all the time of why they're not eating. I know, like for me, when I was bulimic and no one picked up on it, which I don't understand why looking back, but
mhm,
immediately when I sat down to eat, I would get up and go to the bathroom. Right. And so
mhm.
that is a really good sign. Like be mindful, like if you have any worry whatsoever that your child may be bulimic, is look at the bathroom times between, the time that they're eating and the time that they're going to the bathroom, because you pretty much want to relieve yourself of that food immediately.
Yep. Yep.
Right. And wearing baggy clothes, if they're starting to hide their bodies, it's almost like the thinner that you get, the more insecure that the body becomes, right? Psychological, they become more insecure. So they're hiding their body with the eating disorder and they don't want you to know, or they're excessive with working out. I know I was excessive.
Oh
Like,
yeah.
I mean, hours and hours and hours of cardio every day. And I couldn't be thin enough. So there's definitely some red flags that I wish that, I mean, again, my mom and dad did the best that they knew how, but they didn't know any signs of eating disorders. They didn't know what to look for. And
Yep.
again, being very high functioning type A, we can hide it well, right? Like you would never know that we have an issue. I mean, it's the same thing. Like I'm very transparent about it. Like my drinking, and we talked about this. It was something that it was like one thing that relieved tension from me was drinking 1 to 2 glasses of wine a night that became a really bad habit. And I just had somebody ask me this weekend, Cindy, were you really drinking that much that it made you want to have a life of sobriety? And I was like, for me, yes, I was. And no one knew that because I hit it well, right? But
Yeah.
it's a personal choice. And it's again, one of those things that we can control, and you got to watch out for those, because even at 46 I had something that was ruling my world, just like food ruled my world when I was younger. And I think that as long as you can see these things and have the tools to work through it,
Yeah.
you're going to have freedom. And that's what I want to share and teach to people, is freedom away from those vices.
Oh yeah. Yeah. Definitely. Yeah, and
so
that's really going to help you to get there.
So, Drew, what does your journey look like for 2024 for you personally?
Oh gosh. Well, I want to continue on my path. I know right now I'm just facing a little bit of adrenal fatigue, which I'm fixing. But so since diving, I am now also a diving coach. So to continue doing that, but I also found triathlons in the midst of everything. And I want to be able to excel in my triathlon journey. I was originally going to be training for a half Ironman, but now I think right now, and this is really important, especially on the journey, even after eating disorders or with anything, is that you provide grace to your body and then you do for your body what it needs at that time. You kind of have to put the expectations of yourself just aside for a little bit and then just really get healthy again. And it's a process. And it's going to be a process also if you have an eating disorder, it's going to be a process to be able to gather all this information and bring your body back to health. So with that, I want to be able to be thriving again. I want to be doing triathlons this summer. Somebody invited me to do a Ragnar. So it's basically like a relay race where you cover like 95 miles in like the woods, but it's get like 6 or 7 people.
Oh, that's
But
fun.
really, I know I'm so excited about it. So I have a lot of these athletic aspirations, but what I'm really trying to do this year is use everything that I've gone through and all my knowledge with functional medicine and integrative health and my knowledge of athletics and really bring it to the school system so that they can have that support system when these things happen and also can use a preventative way that these kids don't have to lose out on their athletic potential, let alone their health. So that's one of my really, really big
So
goals.
have you, let me ask you this, have you already that just gave me a great idea. And I'm like all about not putting anything on my plate for 2024, but I'm like, oh, that's a really good idea. Have you broke into the school systems where you go in and talk about eating disorders to the athletic groups?
I guess what I haven't really talked about like eating disorders per se. I presented to them how to fuel their bodies properly. And then also I really try to address their belief system and their worth system that what do they believe about themselves? Do they think that they're worthy of actually attaining their athletic goals and that it can actually be done? So I have done that and I'm trying to get it into schools and now I am trying to put together a model where I integrate the functional medicine and integrative health as well as that psychological component and the lab testing and all of that so that they have a well-rounded program so that these athletes can just thrive.
That would be fantastic. Yeah. I just had an idea because we have such a small community where I live and the school system is like pretty brand new. They've
Mhm.
already won state championship. Like I think we've had it for 3 years and they've won 3 consecutive years in a row now. We got phenomenal athletes, like especially the females, phenomenal. And so, yeah, just to go in and speak to them and like really talk about the importance of learning nutrition now, to set them up for vitality, to set them up for success, scholarships, what does college look like for them? I mean, like really make sure that they're thriving as they get older, in the nutrition aspect of it. So they don't have any body dysmorphia issues and they don't have any eating restrictive issues going forward. So I think that's a great idea.
I'm so excited about it.
Drew, thank you so much. And will you tell our listeners some information about your practice? So if someone has anything they want to reach out to you about, they know how to get in touch with you.
Sure. Yeah, definitely. So I'm Drew Mulvey. Obviously, you saw all my credentials, but that really stems from a lot of my health battles and obviously my disordered eating battles. And that brings a passion that I'm trying to work with youth and young adult female athletes to really empower them to make the right fueling choices, to transform their relationship with food and with themselves, and to really reach their athletic potential using several different modalities. You're going to be increasing your stamina and energy. You're going to see what you thought was once impossible be possible, and you are going to be thriving in your life and in your sport. So, if that really sounds like you, and especially if you are in high school or college and you're really kind of confused about all of this, or maybe you're not certain if you are eating enough or if you have any of these signs, I mean, I would absolutely love to speak with you so we can create that firm foundation and that you really live out your athletic potential. So how you can get a hold of me, my Instagram is whole.fit.athlete.nutritionist. And I do have my website, Redeeming Life Nutrition. You can find me on YouTube. I've done a bunch of different lives. I usually do a live every Friday on some sort of topics. And what else do I have? I said Facebook, Instagram, my website,
And I'll
and
make
I
sure to
wrote
post
my own.
that in the notes, in the show notes. I'll make sure to post all your information so they have it as well.
Perfect. Perfect. Yeah, and also I wrote my own cookbook. It's called The No Title
Got
Cookbook, A Label-Free
it.
Approach to Whole Food Cooking, because that's something I want to emphasize is that eating disorders or disordered eating can arise from putting a label on yourself when it comes to food, and you can have fun with any sort of food that is good and best for your body. So that's why I wrote that cookbook. It's really fun.
Oh, I love it. Hey, Drew, I love you so much. And thank you for being on today. And I hope that you and I can record many more sessions going forward because we have so much in common and there's so much to discuss and just to educate the public on. So I adore you and I hope your week is fantastic. And I hope 2024 is all that you want it to be.
Thank you so much for having me, Cindy. And I think just the same as you as well.
All right, girl. It was good seeing you and I will chat with you soon.
Definitely. Take care, Cindy.
All right. Bye, guys.
Bye-bye.